High alert medications. High alert medications that bear a heightened risk of causing significant patient harm when they are used in error. Although mistakes may or may not be common with these medications, the consequences of an error are clearly more devastating to patients. Hazardous material. Materials in various forms that can cause death, serious injury, long-lasting health effects, and damage to buildings, homes, and other property. Hazardous medications that may pose a significant and represent an occupational hazard to healthcare workers because of direct occupational exposure and should always handle with use of recommended engineering controls and personal protective equipment, PPE, regardless of their formulation, IV, SC, topical, tablet, or capsule. The list of high alert medications in our hospital is approved by the Pharmacy and Therapeutics Committee and is based on trusted international references, such as the Institute for Safe Medication Practices, ISMP. Here is the list of high alert medications at Al Darb General Hospital, developed to ensure the safe handling, storage, preparation and administration of these medications within the hospital. The receipt and handover of high alert medications to and from the warehouse shall be carried out only by qualified pharmacists. The delivery of medications from the pharmacy to the hospital departments must be conducted by a pharmacist and a nurse. It is strictly prohibited to hand over these medications to housekeeping staff or any other unqualified personnel. A double check must be performed before receiving the medication from the pharmacy. High alert medications should not be stored on general floors. Only a limited quantity may be kept in a separate locked cabinet, away from regular medication stocks, in specific areas such as the operating room OR, emergency room ER, and intensive care units ICU. Intravenous anesthetics and skeletal muscle relaxants should only be stocked in ICU or an ER. All high alert medications issued to wards or units must carry a caution label stating high alert medication, including those used for parenteral nutrition preparation. Narcotic and controlled medications must be tightly controlled all over the hospital to prevent misuse or dangerous mix-up, and kept in separate steel cabinets with double locks. Verbal orders are only allowed during emergency and repeat back after order, while telephone orders are not allowed when prescribing high alert medication. Ensure proper and correct patient identification, and prohibit the use of abbreviations when prescribing high alert medications. Prescribe oral liquid medications with the dose specified in milligrams, and specify the dose, route and rate of infusion for high alert medication. Never use trailing zero when prescribing, e.g. 5.0 milligrams can be mistaken as 50 milligrams. Reduce the total dose of high alert medication in continuous IV drip bags, e.g. 12,500 units of heparin in 200 of line, to minimize risk. Only consultants and specialists must prescribe high alert medications. All physicians must write daily orders for concentrated electrolytes, heparin, insulin, and all narcotic and controlled medication infusions regarding admitted patients. Safety features in computerized physician order entry must be incorporated in the system to ensure safe medication use and reduce medication-related errors effectively. For electronic systems, never override the hard stop functions and alerts, as these are critical safeguards. Use both generic and brand names for confusion medications, along with the diagnosis, to ensure clarity and safety. Consistent adherence to these prescribing practices ensures standardized, safe, and effective management of high alert medications for all patients. Nurses must double-check all high alert medications before giving them. This means compare the medication label and product with the written order. Label any diluted medication with the name and strength right after dilution. Verify dose calculations if the medication is not dispensed in the exact unit. Ensure infusion pump settings are accurate for continuous IV infusions. Double check means 2 nurses verify these steps independently for safety. Standardized dose calculation tables should be used for all high-alert medications in every patient care area. When a high-alert medication is given by continuous IV infusion, a second nurse must verify a rhonda. The 10 rights: right patient, medication, dose, frequency, time, route, to refuse, to educate, and documentation. The infusion line: trace it from the solution through the pump to the insertion site. The infusion pump is set at the correct rate. During patient transfer, both nurses must check high-alert IV infusions at bedside, confirming patient, medication, rate, and concentration against the written order. All continuous IV high-alert medications must use an IV pump. Only trained staff may administer intrathecal cytotoxic, epidural, or parenteral nutrition medications. In emergencies, an ICU physician may start the medication, but must inform the treating consultant immediately. Return any unused or remaining specially prepared medications to the pharmacy when no longer needed. Always monitor the patient carefully before and after giving any high-alert medication. Check vital signs, lab results, and the patient's overall response to the drug. Keep antidotes and resuscitation equipment available in all wards and units for emergency use. What are the 10 correct steps for medication administration? The 10 rights: right medication. Ensuring accuracy in medication selection. The first and foremost right is the right medication. It involves verifying that the medication being administered is indeed the correct one. Healthcare providers must be vigilant to prevent errors caused by look-alike and sound-alike medication names. These similarities can lead to confusion and result in administering the wrong medication. Right patient. Confirming the recipient. Before administering any medication, healthcare professionals must positively identify the patient. This includes checking the patient's identification with 3 positive patient identifiers. Even if the healthcare provider is familiar with the patient, verifying their identity is crucial to prevent mix-ups. Right dose. Accurate dosage delivery. Checking the medication administration sheet and/or the prescription is vital to ensure the correct dosage is administered. Pay attention to differences between adult and pediatric doses, and be meticulous in measuring and calculating dosages to prevent under- or over-administration. Right route. Administering via the correct route. Confirming the correct route of administration prevents potentially harmful effects and ensures optimal drug absorption. Right time and frequency. Timing is key. Adhering to the prescribed schedule is crucial to maintaining consistent therapeutic levels of the medication. Check when the medication should be given and ensure it aligns with the patient's last dose. This helps prevent missed or extra doses. Also consider if it is a time-sensitive medication. Some medicines need to be given at a certain time to make sure they are safe or work effectively. Right response. Ensure that the medication results in the intended outcome. If pain relief medication was administered, has the patient's pain subsided? Do you notice a reduction in allergy symptoms after giving an antihistamine? Record your observations of the patient's progress and any additional actions taken. Right documentation. Accurate record keeping. Accurate and timely documentation is essential for effective care and legal compliance. Record the administration time, dose, route, and any other relevant information on the medication chart or electronic health record. Right to refuse. Patient autonomy. Patients have the right to be informed about their medications and their potential effects. Explain the purpose, benefits, and potential risks of the medication, and respect the patient's decision if they choose to refuse it after a thorough discussion. Ensure any refusal of medication has been documented thoroughly. Right information and education. Empowering patients. Provide patients with clear and concise information about the medication they are taking. Explain the expected therapeutic effects, potential side effects, and any specific instructions for administration or monitoring. Right reason. Understanding the patient. Whenever medication is administered, the individual responsible for its administration must ensure that the medication is being dispensed for its intended purpose. For instance, using ibuprofen for muscle aches, administering an inhaler for an asthma exacerbation. High alert medications are drugs that carry a higher risk of causing serious harm if used incorrectly. It is essential for healthcare staff to be cautious and double-check before administering them, and always follow hospital guidelines, verifying doses, routes, and timing. In conclusion, remember that adhering to proper procedures and safely handling these medications is not optional, but a responsibility to protect patients and ensure their safety.